United States, we have the most being spent on a per capita basis of any industrialized country in the world, and we don't even rank in the top 25 in terms of health outcomes.
Solely within our state, there are huge health disparities. The life expectancy difference from one place in the state to another is 20 years.
We don't have equal access among providers or even patients. Some of them who have insurance are able to get an appointment quickly, whereas someone who doesn't, we kind of let them fall through the cracks.
What we have is a healthcare delivery system which is technologically advanced at the level of detecting some particular disease and perhaps finding a way to treat that. We do not have a way to keep people out of the hospital as our objective. The actual measurement of our success is our community healthier or not? And if it isn't, that's our responsibility.
Our idea of how to change the future of health is something that we are clearly doing because we want to care for our local community. But we believe that it's the beginning and the template for how others may want to do the same thing in other places.
It's really about creating a new paradigm for health and developing ways to scale it around the country and around the world.
We've built an institution which is agile, which is innovative, which is adaptive, which is technologically driven. We are really capable now of taking on these kinds of challenges and really putting a dent into making things happen.
We love complicated problems. Problems are complex in their very nature. And the classical way people think about these sorts of things is they come at them from the discipline that they were trained in. But in the real world, no single discipline is going to get a problem solved. Communication is the key to discovery. It's getting people together with different backgrounds to think about new ideas and then work on them from new perspectives.
It's not a function of just sitting around saying we need to produce more doctors. We do. Or more nurses. We do. But different doctors, different nurses, different tools, different systems.
We're starting a new medical school, the School of Medicine and Advanced Medical Engineering, putting engineering, AI, data science right into the middle of our health education, but also putting it in a humanistic frame.
Our approach to producing a doctor is going to be every physician that we produce will also be an engineer, and every physician engineer that we produce will also be completely AI enhanced. What we're after is precision through technology and the delivery to the individual or the community setting, what you need to get better health outcomes.
What makes a person healthy? It's not only medicine or surgery, but there's other things, the lifestyle factors, those what we call those social determinants of health.
I call them community-facing initiatives, ensuring that individuals have reliable health information to make the right kind of decisions for their own health and for their families.
If we want to impact thousands of patients, we need to find out how do we catch those diseases earlier? How do we come up with better approaches to avoid those diseases entirely? We screen all the various genes and proteins that the human has to see if any of them could be markers for disease. We have a library of every gene in the human. We've shipped them to thousands of labs on the planet. Whatever we build, we want to share with everybody out there. It's a small community, but it's also a big world, and the two are directly connected.
ASU is providing resources and opportunities for students to get the tools that they need. When they go out into the real world, they're able to tackle on these challenges with real solutions, innovative ideas, where they can take care of patients effectively and also promote healthcare.
What we're trying to create is a completely new paradigm for preparing the next generation of health professionals that will lead to better education, better care, and better outcomes. The opportunity to bring something like this together to actually move the needle on health outcomes is very exciting.
We're now taking everything that we're doing with our staff of over 30,000 people, 6,000 faculty members, hundreds of academic programs, 20 colleges, 40 transdisciplinary schools and institutes, and now we're applying every asset that we can conceivably apply to this notion of changing health and well-being outcomes for everyone.